Hi, thank you for joining. This is Kevin from Emergency Management. We will be beginning the March Ready Up in New York City Vaccine Information and Preparedness webinar in about 15 to 20 minutes. So just stand by and we'll start soon. Hi, good afternoon, everyone. This is Kevin from Emergency Management, and thank you for joining for this month's Ready Up NYC webinar. We are going to begin in about 10 to 15 minutes, give or take. So yes, please bear with us, and we'll talk to you all soon. Hi, welcome everyone for joining. My name is Kevin Leung from New York City Emergency Management. We will be beginning the webinar shortly. It is about 1:25 right now, so we'll begin in about 5 to 10 minutes. So bear with us and we'll get started soon. Thank you so much. Hi, everyone. Thank you so much for joining. My name is Kevin Leon from New York City Emergency Management. A lot of people just joined. So just wanted to give everyone a heads up that we are still starting around 1:30, 1:35. Just bear with us while we wait for others to join. And we'll begin shortly. Thank you so much. Hi, everyone. Thank you so much for joining. It is about 1:30 right now. We'll give it a couple more minutes for everyone to join in before we start the webinar. Thank you so much.
Hi, this is Rima. Can you hear me?
Hi, Rama. We can hear you. Thank you so much
Great.
for joining.
Thank you.
We will begin in a couple minutes, giving some of the stragglers some time to get in.
Super.
Hi, everyone. Thank you so much for joining. We will begin in about a minute or so. We still have a couple more people joining, and yeah, we'll start there. Awesome. So yeah, I think we're gonna get started here. Before we start, I can introduce myself. My name is Kevin Leon from New York City Emergency Management. Please leave all questions for the end. This will be a pretty comprehensive webinar, so hopefully everyone will get all the information needed before any questions can be asked. As well as this is going to be recorded to be shared. We will share the YouTube as well as the PDF for the PowerPoint and email it to all of you within the next couple days. And yeah, we will get started from there. So again, welcome everyone to the March Ready Up New York City Vaccine Information and Preparedness webinar. Today we are joined by the Department of Health and Mental Hygiene to really talk about vaccine preparedness and vaccine information. But before we get started, we are going to talk a little bit about New York City Emergency Management. And New York City Emergency Management, our goal is to really help New Yorkers before, during, and after emergencies through preparedness, education, and response. We have over 200 employees from various different agencies within the city, such as the Department of the Fire Department, the Police Department, the Department of Sanitation, etc. And we all come together to really help and support New York City through any type of emergency that we may encounter. So before we get started, we always want people to be prepared. And that's one of the most important things for any type of emergency is to be properly prepared to know what to do in case an emergency happens to you and your family. So we really encourage everyone on here to download the My Emergency Plan that you can find at nyc.gov/readyny. This plan is a comprehensive plan that really gives you all the information on what to do, how to plan, how to inform your family, and how to really make sure that your family is safe when an emergency does happen in New York City. And going through that, we have three very basic steps. We'll touch briefly on this, which is one, we always want you to make a plan, which is having a list of things to do that makes sense for you and your family. And that list can range from evacuating your home through not forgetting your go bag. And moving from that is when you do have a go bag, that's kind of gathering the right supplies, the right things that you need for you and your family to be properly prepared. And that is super, super important because a family can have a whole wide variety of things that they need to be prepared, such as a family with children might need toys. A family with older adults might need some medicine and things that their household needs that some don't. So having the right supplies is super important. I am a bigger individual, so I would need more food and water compared to someone who is half my size, where they might not need as much. So depending on the situation that you're in, having the right supplies is very, very important. And when you are prepared, you always want to stay informed, which is our last step. Information is the key to preparedness. Knowing what the weather is like, listening to this webinar, and getting the right information on how to be prepared is super, super important. And we really want you to have all the information that you need, such as Notify NYC, the Ready NYC app that you can download through your Android devices or iPhone through the Apple Store, really allows you to be properly prepared and allows you to plan with your family on what to do when an emergency does happen. But enough of this, and enough of us talking about emergency preparedness, but now we're going to get into the thick of things. And I really am so happy to introduce Rema Oken. She is from the Department of Health and Mental Hygiene. She is the Director of Policy for the Division of Disease Control at DOHMH, and she has a Juris Doctor and a Master of Public Health degree, with her work including initiatives aimed at immigrant and LGBTQ communities and other priority populations. Rema has been working on the Health Department's COVID-19 response since February of last year in the Health Department's Public Information Office. So Rema, welcome, and thank you so much for joining us. This is going to be super exciting, and you have the floor. It's all yours.
Super, thank you. Thank you so much for having me today. I'm very excited, and not just something I'm saying, it's true. I'm very excited to be talking about our vaccines. We're really at an incredible place in New York City with our vaccine rollout, and something that we are just super focused on doing is getting as much information out there about the vaccines that we can, answer people's questions, address any concerns people have, so that people can make a vaccination decision for themselves. So I want to start out by talking about where we are in our response to the COVID-19 public health emergency. So we always begin presentations with a very, very important acknowledgement of the inequities that the COVID-19 pandemic has laid bare in the US. There were more Black and Latino people that were sick, hospitalized, and died from COVID-19 as compared to other racial groups. And while upsetting to see these disparities, it wasn't surprising given the long history of inequities that we have in the city and around the country due to policies and discriminatory practices that prevent communities of color from accessing vital resources and opportunities, which, anything from housing to education to health insurance to food, all of that translates into poor health outcomes, and that's exactly what we saw with COVID-19. Our approach as the health department and as the city of New York, next slide, please, is to make sure that equity is central to everything that we're doing in responding to the COVID-19 public health emergency. And of course, that includes our vaccine program. We recognize that we need to build the trust and confidence of the communities that we serve, and that we need to provide information that is relevant to the communities we serve in the languages that are relevant to them, and that community involvement and partnerships are absolutely key to being able to do that effectively. So that is really our commitment to you all and to communities around the city, that we are going to take actions to address health and social inequities that have been laid bare by COVID-19, and that we're going to provide the facts and information that people need to make informed decisions about vaccination. So a little bit as to where we are in the vaccine rollout. These are really exciting numbers. If you think that vaccination started in mid-December, and it was a slow start, largely because we didn't have that much vaccine, but we've really ramped up in the last month or so and continue to do so. So looking at the numbers around the country, it's really quite incredible. Over 100 million doses of vaccine have been administered around the country. And we have nearly 50 million people that are fully vaccinated. We should hit that 50 million mark in the next couple of days. And in New York City as well, really incredible that we've administered over, nearly 3.5 million doses of vaccine, and that we have over 1 million people that have been fully vaccinated. Next slide, please. Great. But it's really important to keep in mind that as exciting as all of the vaccination work is, and that it does give us this light at the end of a very long tunnel that we've all been traveling, that we are still in the middle of a second wave of COVID-19. Here you can see just the kind of the curve, the two humps that we've had in the city, of course, in March and April, the first wave of COVID-19. And we do appear to be coming out of the second wave. Just to note that recent data is incomplete, so that sudden drop off there is not accurate. But yes, we are hopefully getting over our second wave, and we'll continue to see the numbers go down. But we still have a lot of COVID-19 in New York City, and you can see here on the map, which is a breakdown of zip codes and the percent of tests that have come out positive, looking at the last 7 days, that we still have huge portions of the city that have a lot of COVID, and it is disproportionate in that a number of neighborhoods in the Bronx and Queens and Brooklyn, some of the same neighborhoods that had a disproportionate share of COVID in the first wave, are unfortunately again having more COVID, more hospitalizations, and more deaths, and we really are working hard to change that. Next slide, please. So now I want to give just a bit of a breakdown of vaccination by race and ethnicity, and also zip code. So here, we'll start with the map on the right. Here, darker means better, unlike the prior map. So the darker places are where there's been greater vaccination. And it's unfortunately, it's kind of a flip-flop in some cases of the prior map, and that the areas that have less COVID, like New York, areas of Manhattan, tend to be higher vaccinated. And so we really need to work hard that the vaccine is getting to everybody and to all the right people. And that's on us as a city and as the health department to do. You can also see here, and just looking at the percent of people that of different race and ethnicities that have been vaccinated, that a disproportionate number of whites have been vaccinated, particularly as compared to Latino and Black individuals. We are improving, but we still have a lot more work to do. Next slide, please. So just to give some key messages about COVID-19 vaccines. The vaccines save lives. This is true of most vaccines, and it's true of COVID vaccines. So vaccines are absolutely critical historically and presently to saving lives. The COVID-19 vaccines are safe and effective. They are provided at no cost to everyone. The vaccines are available to people of all immigration statuses, and vaccination is not a public benefit under the public charge rule. So there's no negative immigration related repercussions that could happen from getting vaccinated. And when people are vaccinated, their privacy will be protected. So really just highlights that we want that everyone can and should have access to vaccine, and they're safe. And I'm going to now give you some information explaining why we feel so confident in saying that these vaccines in particular are safe and effective and save lives. So I'd like to start by talking a little bit about the development of vaccines in general, and also the COVID vaccines in particular. So all vaccines, prior to them being able to be used, have to go through what are called clinical trials. There are 3 main phases of clinical trials, and each one builds upon the prior phase. So you have, a phase 1, which is usually less than 100 people involved. And this is actually, this is after a vaccine is developed in a laboratory and undergoes some level of testing. When we start to test it in people, volunteers, so it's always volunteers that are selected. And then ultimately, when you have phase 2, you have hundreds of people that are tested with a vaccine. And then phase 3 involves thousands of people being tested with a vaccine. And then even after a vaccine is authorized, sometimes these clinical trials continue, which is why you still may be hearing about clinical trials for some of the vaccines that we're already using. And that's to say test the vaccines amongst different groups, or to follow the existing participants for a longer period of time to make sure that the vaccine is doing everything it's supposed to do. So, and that is in fact happening here, but I know there's some confusion as to the clinical trials, and I want to be clear that the COVID vaccines have gone through all of these required phases of clinical trials, but we're continuing to study and monitor the vaccines because they are new vaccines. A bit now about the FDA authorization process. So it's the U.S. Food and Drug Administration that authorizes all vaccines, and they're involved in the entire process. So it's not just a stamp that they give at the end. They are involved in looking at the clinical trial plans and protocols. They're involved in closely monitoring the clinical trials all along the way. So if something bad happens, they can and they will stop clinical trials until they can investigate and make sure that it wasn't a problem with the vaccine. Their scientists and medical experts also have to review all of this material in order to authorize a vaccine, which is what happened here with each of the vaccines separately. And then just to note that there's independent medical experts. So there's a board within the FDA that has, that has doctors and scientists who are not part of the FDA, who are also looking at all of this information in order to make an assessment as to whether to authorize a vaccine. So in cases of emergency, like COVID-19, what the FDA can do is issue what's called an emergency use authorization. And this enables people to start using the vaccine right away if it is authorized. Importantly, no shortcuts are taken in testing the vaccine in the clinical trials. The clinical trials that I just went through, that happens for all vaccines, and that happened for these vaccines. And the FDA is able to issue an EUA if they see that the evidence strongly suggests that the benefits of vaccine outweigh any risk to patients. And just to note that all the COVID-19 testing that is out there, that too is under an EUA. So this is an important process that enables things to happen much more quicker than they usually do, but it doesn't mean that it's not being watched closely and that any safety measures were shortchanged. Next slide, please. And I mentioned this before, but really to highlight this point that we are continuing to monitor these vaccines extremely closely. In fact, the monitoring going on with the COVID-19 vaccines is greater than any other vaccine in US history. And that is precisely because they are new. And so we really are just watching them so closely. The FDA is, the CDC, the other federal agencies, such as including the Centers for Disease Control and Prevention, independent experts. I mean, there's publications on these vaccines all the time from other countries as well. So really just being monitored from so many different angles. And there's a requirement with the vaccines to report anything bad, a list of possible bad events that could happen, say an allergic reaction, or something happens to the individual following vaccination, even if it's not even clear if it's related to the vaccine. But just in the interest of full precaution, events need to be reported through a system that's called VAERS, the Vaccine Adverse Reporting System. And that's just so it can be investigated, again, to just watch these as closely as we can. And there's also a smartphone app, which has proven really useful. I think this is the first time anything like this has been done. And this allows, and it's voluntary, but it allows people who are receiving vaccine to report all the side effects they're getting or anything else. And in fact, they can even reach out to the CDC if they have questions. So it's a great app, aside from helping, patients, understand their side effects and giving them appointment reminders for their next vaccine dose, if it's a 2-dose vaccine, but it's also giving really important information about data, about side effects, about people who maybe have, an underlying condition or say are pregnant and are getting vaccinated. That information, again, it's voluntary, is collected. And so it's just one other incredible source of information we have about these vaccines. Next slide, please. There has been a lot of in the press and concern otherwise, and understandable concern, I would note, about the speed with which these vaccines went from development to going into people's arms, really. And I want to explain how that was possible. It is really important to note that these vaccines that we're using were not developed overnight or even in 1 year, that they built off decades of research and development from other vaccines, and also for vaccines for other coronaviruses. So COVID is part of the coronavirus family, and there are other coronaviruses, including one of the viruses that cause a common cold. And so these have been studied, for years, and they built off that body of research. There was also an incredible amount of funding from the federal government and others that enabled a much quicker process. So parts of the process that usually happen sequentially, say first doing all of the research, then getting approval, and then having the manufacturers rev up and start producing the vaccine. A lot of that happened. So the manufacturing was able to happen before the vaccine was even authorized, which would never happen in a non-emergency scenario because it's too much of a financial risk. But because of the amount of money that the federal government gave, it enabled this to happen at the same time. That is really critical to understanding how we were able to get these vaccines out so quickly. And also just, the federal government, the state governments, us here in New York City, we've been planning this since last summer. So, it's not something that you get a vaccine, it's authorized, you wait for the manufacturing, then you start getting your plans in place. All this was happening at the same time. So we were ready to hit the ground running when the vaccines were authorized in December. So there have been 3 vaccines that have been authorized for use in the United States. There's a vaccine from Pfizer, one from Moderna, and one from Johnson & Johnson Janssen. And I'm going to talk to you a little bit about how these types of vaccines work. So the Pfizer and Moderna vaccines both use the same type of technology, which is called mRNA. So they are mRNA vaccines, and the M stands for messenger. And these vaccines contain genetic material from the COVID-19 virus. They do not contain the COVID-19 virus itself, but rather just some genetic material from that virus. These are the first mRNA vaccines out there. There have not been ones prior, but the mRNA research has been going on for over 30 years. So the way it works is the mRNA enters your body by way of the injection of the vaccination, and it instructs your body to make a protein that is part of the virus that causes COVID-19. So there are many parts of the virus and many proteins, and this instructs the body to make a specific type of protein. So the protein produced triggers your body to create antibodies because this protein is new. It's something different. It thinks it has to fight it. So your body creates these antibody defenses to this protein. The mRNA, which was the instructions that your body got, that is broken down and destroyed and removed from your body. And then later on, if you're exposed to the COVID-19 virus, you now know how to fight it. You're able to quickly build, you have the antibodies already, you're able to quickly build the defenses so that you don't get sick if exposed to COVID-19, or if you do get sick, you don't get nearly as sick. Next slide, please. So the Johnson & Johnson vaccine, which is the third vaccine that is authorized in the U.S., is a slightly different technology. It's called an adenovirus vector vaccine, but it works in pretty much the same way. It just has a different messenger system. So that's where the vaccines differ. So to make the adenovirus vector vaccine, scientists took a gene from the virus that causes COVID-19 and put it into another virus, an adenovirus, which essentially is a virus that causes the common cold. Importantly, the scientists changed that virus, so it's not going to cause a cold in you. It can't replicate or multiply like other viruses can. It's just basically the host, if you will, for the genetic code from COVID-19 and the way that it gets into your body. And again, very, very similar way that it works once it's inside. The gene in this case from the coronaviruses causes your body to create the protein. Again, now your body sees this foreign protein and creates antibodies and other defenses to fight it. And then down the road, again, if the person is exposed to COVID-19, they now know they have the antibodies in place and their body knows how to fight it. So here is just a table to provide just some basic information comparing the clinical trials and other information about the 3 vaccines that are authorized. One critical note here, and I'll go into more detail later, is that the Pfizer and Moderna vaccines are 2-dose vaccines versus Johnson & Johnson is just 1 dose. All 3 cause mild to moderate side effects. I'll explain some of those a bit later on. And here you can see the number of participants in the clinical trials. So each of these vaccines were, the clinical trials involved tens of thousands of people. That's before we even started using it. And now, particularly with Pfizer and Moderna, we have data for millions of people as these vaccines have been used, and Johnson & Johnson, we're building up more information every single day. The clinical trials included people of all age groups. This is very important, including people 65 and older. So you can see the percentages there. Over 20% of participants were 65 and older in all 3 clinical trials. They included people of different race and ethnicity. Again, very important, to know that this is that there was a diverse group of people that the vaccines were tried on, and then ultimately another distinction here is that the Pfizer vaccine was only authorized for people 16 and older, and whereas the Moderna and Johnson & Johnson vaccine for people 18 years of age and older. Next slide, please. So in terms of how well the vaccines work, all 3 vaccines were shown to be safe, and they were all 3 shown to be effective across all gender, race, and ethnicity groups. So this is very important. So, as we saw on the prior slide, it varied by vaccine, but, over 20% of the vaccine, the study participants were people of color. It was higher, in fact, in Johnson & Johnson. A lot of it has to do with the countries in which these vaccines were studied in. And it worked. These vaccines worked well across all these age and gender and ethnicity, race and ethnicity groups. No one receiving vaccine died from COVID-19, which is amazing. Again, this is for all 3 vaccines. The clinical trials were separate, but that's the same result there. And all vaccines were shown to be very, very effective at preventing severe COVID-19 illness and hospitalization. So, and just a note here to add about the COVID-19 variants, which I know have been in the news a lot and are new, and I guess like a lot of things with COVID, we're still learning about them. But we do have some preliminary evidence that these vaccines do work against the main variants that we're seeing. In some cases, they may not provide as strong a protection, but they have been shown to protect, including protecting against hospitalization and death, which is very positive, that we do have this, at least this initial information coming in, that these vaccines are still effective at preventing the most severe outcomes of COVID-19. But again, we still have some more study and work to do in that regard. So here's some, some of what we don't know yet about the COVID-19 vaccines. And this is, I think, critical to gaining people's trust in these vaccines, is being honest about what we know and what we don't know. While we feel very confident saying the vaccines are safe and effective, we don't know how long the protection from the vaccines will last. So only time will tell. And they are doing studies to see, they're still following the clinical participants to see how well the vaccines continue to work in them. But unfortunately, since they are new, this is again just something that time will tell. We don't know whether additional doses will be needed in the future. So, right now there's 1 dose for the Johnson & Johnson vaccine and 2 for the Moderna and Pfizer vaccine, but it's possible that people will need a booster shot or may need an annual shot, something more like the flu shot. Again, just something we don't know yet. We still don't know whether the vaccines are safe and effective for children. So that's why the vaccines were authorized only for the adult age group, except for Pfizer, which is age 16 and older. But there are studies ongoing that have already started, which is great. So we hope to have a vaccine authorized later on this year for children. And the last one's an important one, and it's that we don't fully understand yet how well the vaccines prevent people from spreading the virus. So we know that if you get the virus, you may have no symptoms at all or very mild symptoms thanks to the vaccine. And it may prevent you from getting the virus entirely in some cases, but we really need to understand more about how well the virus, if you do get it, how infectious or contagious you might be. So that's really important for understanding how well the vaccines protect the people around you in addition to it protecting you. There are studies ongoing, and there's some really positive information coming in this regard. Some information from the clinical trials, some from countries that have really high vaccination rates with these vaccines, laboratory studies. So we do have some good and positive information, but we still need to study it more to just better understand this. For the benefits of vaccination, it comes back to a lot of what I just said, that there is very strong evidence that the vaccines are safe and effective. COVID-19, and this is something I really want to drive home, is it's a scary illness. It definitely is more dangerous for older individuals and people with underlying health conditions, but all people of all ages have been hospitalized and died from the virus. And there's some long-term effects and health problems from COVID that we're seeing now, and we don't know how long they will last, and we don't know what will happen in the future. It is a very serious disease, and so vaccination is really our best tool to stop people from getting these serious effects of COVID-19. And as I just noted, the vaccines may also protect the people around you, and we're still looking at that. And it really is the #1 way of moving us closer to ending the COVID-19 public health emergency. So now I'm going to talk a bit about the kind of the nitty-gritty of how you go about getting vaccinated in New York City. So the first thing is the vaccine is not offered to everybody yet, as there is not enough vaccine out there at this point in time. New York State, as all states are, New York State is setting criteria for who is eligible to receive the vaccine first. And so all these decisions are made at the state level for New York City. And basically, the people being prioritized fall into one of 2 groups. It's either people that are at increased risk of getting COVID-19, so they have more exposure in their job, say, or otherwise, or people that are at increased risk of getting severe illness if they do, in fact, get COVID-19. So the people that are eligible has expanded significantly in the last weeks, really. Healthcare workers have been eligible from the beginning. just this week, people 50 and older are now eligible for vaccines. That's all people 50 and older. It was previously 60 and older. So a whole decade of individuals is now added are now eligible for the vaccine, which is great. People in certain congregate or group living facilities, such as nursing home and homeless shelters, are eligible for vaccine, and then a number of different types of essential workers. There's a very, very long list, so it's not listed here, but includes, anything from first responders and teachers, transit workers, grocery store and restaurant workers, hotel workers. So it's a long list, but a number of essential workers that are an increased risk of exposure there. And then also people with certain underlying medical conditions that increases their risk of severe illness. Next slide. Thanks. So as far as when vaccine will be ready for everybody to be, for all adults or all people, I should say 16 and older, sooner than we thought. This is a new, this slide was recently updated. It used to say that we think everyone will be ready in the summer of 2021, but now it's sometime in the spring. The federal government has committed to getting enough vaccine manufactured for all adults with it, for sometime in May. So once it will still take some time to get all that vaccine and get all that vaccine into people's arms, but we really do expect that by May, likely all everybody will be eligible, all adults, everybody 16 and older will be eligible for vaccine. And then I've listed here our webpage that lists all of the specific eligibility groups. So that is the web address for that. Next slide. So as far as what we're doing, kind of going back to where I started the presentation, is so much of our vaccine distribution is focused on ensuring that people that are at the highest risk, people that have less access to vaccine in general, and certainly COVID-19 vaccine, can gain access to vaccine. And here's how we're doing that. We're opening vaccine sites in the communities most impacted by COVID-19, and we're limiting some sites to specific zip codes or specific boroughs to just make sure that the people that actually live there are getting the access to those vaccine appointments. We're making sure information is available in multiple languages. So all of our public-facing materials are translated into 13 languages, and sometimes more at request or as needed. We're giving presentations in different languages, our website materials in different languages, and at the vaccine sites, we make sure that there is access to either individuals there that speak a different language, or we can connect people to through a language service. We're also working with CBOs, community-based organizations, clinical partners, faith-based organizations, and community leaders, recognizing that those are trusted individuals in the community, and it is critical that we have not just us as the health department telling people to go out and get vaccinated, but that trusted community members are also going out and doing the same. We're listening and responding to community feedback and input, and we are closely monitoring the data to make sure that what we're doing is working and that we are getting people access to the vaccines. Here's just a list of who can and cannot be vaccinated. The can group is much larger than the cannot group, which is great. Again, noting that it's only people 16 and older who can be vaccinated. And then really all other groups can be vaccinated. So people with medical conditions can be vaccinated. So this is very important that the clinical trials included a number of people, upwards of 40% of people that had an underlying medical condition. So the vaccines, are safe for people with underlying medical conditions and effective. There are a few groups, such as pregnant individuals, people who are breastfeeding, and immunocompromised people who were not included in the clinical trials. And so we don't have as much data on those individuals, but they are still eligible to be vaccinated. And we just would really encourage anyone that has questions or concerns about their own medical, conditions, or questions whether they're eligible to speak to a healthcare provider if they do. But really, all groups are eligible for vaccination. Next slide, please. As far as where people can get vaccinated, so some people can get vaccinated at work. Healthcare workers often can if they work for a hospital. Some large employers, including the city of New York, is offering vaccination to eligible employees, either directly on site or at specific locations. So there are a number of employers, larger employers in general, that have vaccine eligible for their employees. There's also a number of city-run sites and also a few state-run sites, or there's many state-run sites, but only a couple of them are in the city. That we opened up just for COVID-19 vaccination. And so these are located in all 5 boroughs. The number of state sites is expanding too, because through a partnership with the federal government, which is great. Also, a number of healthcare facilities that began just vaccinating their staff are now opening up their facilities to vaccinate patients, which is great. So you can also check with your primary care doctor and see if any of the healthcare facility that they're affiliated with is giving vaccination. Federally qualified health centers are vaccinating, and pharmacies. There are many pharmacies out there, and more weekly that are now starting to vaccinate. Pharmacists are more limited in the populations they can vaccinate, but that too is expanding. So now pharmacies can vaccinate people 60 and older, people with an underlying health condition, and teachers and other school staff. Here I've listed the Vaccine Finder web address. That's nyc.gov/vaccine finder. And this has many of these sites, all of the city sites, all of the state sites, many pharmacies and private sites as well. It lists the vaccine type there. So while we think that all 3 vaccines are extremely safe and effective, and there's no preference for one over the other. If there's some reason that someone wants one vaccine over the other, that is listed there. And certainly for people that are 16 or 17, they do need to get the Pfizer vaccine, so they have to make an appointment at a site that has Pfizer. And it also, you can search, this website will take you to the other websites so that you can make an appointment, which is essential. Next slide, please. So here's the 5 steps to making the vaccine appointment. First, check if you're eligible on that first webpage that I noted. Then you go to the Vaccine Finder, and you can make an appointment there. There's also a phone number we've listed here, 877-VAX for NYC, and that is for help making appointments at city-run sites. Our website does list, the sites that currently have appointments, which changes frequently. So do please go back there often. You also need to complete a New York State vaccine form. So that's for everybody, regardless of what site you go to. You're going to have to complete this form, which basically affirms that you're eligible to receive the vaccine. And then you need to go get vaccinated. And when you do so, you will need to bring proof of eligibility. There's details about that on our website. And also you should get some details when you make your vaccination appointment. And please remember to wear a face covering to protect you on your way to the site. And also you will not be allowed into vaccine sites without one. And then if you're getting the Pfizer or Moderna vaccine, please remember to make an appointment for a second dose and get your second dose of vaccine. And here is an image of our Vaccine Finder page. I've gone through most of this already, but just wanted to show you where it is and just show you that in the upper left-hand corner, you can select language, so you can get the page translated into another language, and that you can search through zip code, or there's also through an address, or there's a Near Me button that you can hit as well. So just a number of ways to check. And then again, just noting, please go back with, if you don't have any luck getting an appointment, please check back regularly because new appointments are added all the time. And now you just to talk briefly about the second dose, which is needed for the Pfizer and Moderna vaccine. So you will get some protection after getting your first dose, but this is a two-dose vaccine. So in order to get the full effects of the vaccine, it's very important to go back for your second dose. You're required to get your second dose at the same place where you got your first dose. And that site will help you make a second dose appointment. It has to be the same vaccine. So if you got Pfizer, you need to get Pfizer again for your second dose, and the same thing for Moderna. And here's the schedule, which is very similar between the two vaccines, just a 1 week difference. But you should get your second dose of the Pfizer vaccine 3 weeks and no more, ideally, than 6 weeks after vaccination. And for Moderna, it's 4 weeks and hopefully no more than 6. But if more than 6 weeks passes, and this is very, very important, you should still get your second dose. And you don't need to start again with your first dose. So if you have to cancel for some reason, you go out of town, you're sick, you're unwell, don't worry, just make an appointment for as soon as you can after that. You shouldn't get your appointment before the recommended time period here, but you can get your second dose after if necessary. And you're going to be given a proof of vaccination card at your first appointment, and to remember to bring that to your second appointment. As for side effects, so being honest and open about it, most people do have side effects, and some people have them worse than others. But we want people to understand that even if it's unpleasant, it's part of the process, unfortunately. And it's usually just a sign that your body is building protection. So it's not a bad thing, it's actually a good thing. But you should expect that. And the side effects can vary, and this is for all 3 vaccines. All 3 vaccines have similar side effects. So soreness and swelling in the arm where you got the shot, of course, but also headaches and body aches, tiredness, and fever. The side effects, the good news is they're pretty short-lived. So most people have them for 1 or 2 days at the most. They usually start within the first 3 days, and the most common is the day after your vaccine. And they're less common in older adults. And for the Pfizer Moderna vaccine, they're more common after your second dose. So we just want people to be prepared and not be worried if they have these side effects, and also to plan ahead, and just in case you don't feel well the next day. So just to take that into account when you're scheduling your vaccine appointment. So if you do get side effects that worry or concern you, you should call your healthcare provider. Also, if the redness and swelling in your arm actually increases after 24 hours, you should check in with your healthcare provider. You can also call 311 if you have any questions and you don't have a provider. And just to note that even if you don't feel great after your first shot of the Moderna or Pfizer vaccine, we really, really want to encourage you to please just go back and get that second one, even though that might be the last thing you want to do. But please do that. It is, they're short-lived side effects, but it's for a very, very good cause. Next slide, please. And now just a note about allergic reactions. So, and this is really to distinguish between allergic reactions and side effects. Allergic reactions are uncommon, and severe allergic reactions are very, very uncommon. Really only a handful in millions of people being vaccinated. It's very, very uncommon. If you do though have an allergic reaction, well, first, sorry, I got ahead of myself. First, let me tell you what allergic reactions might prevent you from being able to get vaccinated. First, most allergies are not an issue for the COVID-19 vaccine. So food allergies, pet allergies, dust, pollen, latex, all the most common allergies people have, peanuts or what have you, that is not a concern for vaccination. If you have a history of an allergy to another vaccine or to any injectable drug, you can speak to your healthcare provider about that. But all other allergies are really not a concern to vaccine. if you have once you're vaccinated, you would normally get an allergic, you would get allergic reaction almost immediately, within the first hour usually, and the symptoms are very different from side effects. So you had difficulty breathing and swelling in your face and throat, a fast heartbeat, possibly dizziness and weakness. So, even if you're feeling severe side effects the next day, you have a fever, you have chills, you have headache, those are just so people feel comfortable, those are side effects, and by all means you should call your healthcare provider if you have concerns. That does not mean you're allergic to the vaccine. If you do, though, have any questions at all, or if you experience any of these symptoms here, please do immediately call 911 or go to your nearest hospital. Next slide, please. After vaccination, so this is the hardest slide of the whole deck, and one, I think it's the second to last. So what's really important is that, and I've said this before, but it bears repeating, is that while we know the vaccines is the most important thing you can do to protect yourself from severe illness, from hospitalization, and from death, that is attendant to COVID-19. But because we still don't know how well the vaccine protects the people around you, it is really important that we still take all these precautions that we have been taking for the last year, and that we continue to do so, like wearing a face covering, staying 6 feet from others, staying home if you're sick, washing your hands often, because we still really don't know how well the vaccine prevents people around us. We are hopeful we can, change some of these restrictions in the future, and we will update our guidance as necessary. But remember that a lot of people still have not been vaccinated, that children aren't even able to get vaccinated yet, and some people may not be able to get vaccinated for a health reason, which is very uncommon, but it can happen. So it's really important that we protect the people around us. And as much as we are so sick of wearing our face coverings and so sick of hearing about 6 feet of distance, we still really need to follow that, particularly in public, when there's people around us that we don't know whether or not they've been vaccinated, or maybe at increased risk. Next slide, please. So with that in mind, so what should we all be doing right now? Keep practicing these prevention measures, whether or not you've been vaccinated. Also reminding people that we still have a lot of COVID transmission in New York City and around the country and around the world. So, really important that we fight COVID-19 with every tool that we have, vaccination being one of the most important, but also these other safety measures. Also take care of your mental health. This pandemic has had, told and untold consequences on people's, from of course loss of loved ones, to the virus, but also loss of jobs, loss of our way of life, and all of this can be extraordinarily stressful. We really just want to encourage people to seek help. Here's the information for NYC Well, which is in New York City's free and confidential helpline, where you can speak to a counselor 24 hours a day, 7 days a week. And that's 888 NYC Well. You can also text Well to 65173. And then also we're looking for people to help us spread the message about vaccination. So share your experience getting vaccinated if you have been vaccinated with others. A lot of people aren't going to feel comfortable vaccinating until they know people that have been vaccinated, until they, people that they trust are telling them like, hey, I got it. So with that in mind, like if you're social media savvy, we've got, you can share I got the shot NYC or NYC vaccine for all, or whatever hashtag you want to put. and just to really help people get accurate information about the vaccines. There's an email address here, so if you know of an event or in the community and you think it'd be helpful to have this presentation or a shorter one, I recognize I've been speaking for a while. We'd love the opportunity to be able to just speak to more and more people and share this information. We have a ton on our website as well. So please help us help New York City by spreading the word about vaccination. And I think that is all as far as my presentation, but I'd be more than happy to take any questions that people have.
Awesome. Rema, thank you so much. That was a great presentation, and I learned so much from it. We do have a couple questions that are coming up, and then, yeah, I'll read them out to you, and if you want to, you're more than welcome to answer it. Yeah. So the first question is from Lisa. Her question is, when is the Johnson & Johnson vaccine going to come to Staten Island, other than homebound individuals?
So we don't have a specific date other than to say that we do know that we are going to be getting more in, particularly next month. The reason why we're limiting Johnson & Johnson to homebound individuals and other priority groups is the vaccine is much more transportable than the other two vaccines. It has much less strict requirements for storage, and it's one dose. So people that are harder to reach, like homebound, that's who we have to prioritize for the vaccine because it enables us to reach them. But we do expect, particularly over the next month, and then much more so over the next 2 months, that we'll have a lot more Johnson & Johnson vaccine, and it will be more readily available. And if you just keep checking, the Vaccine Finder lists the vaccine that each site has. So you'll start seeing, over the coming weeks and months, more and more sites listed there that say that they have the Johnson & Johnson vaccine.
Awesome, great, thank you so much. Another question is from Marilyn Green, and she asks, can you please email participants this PowerPoint slide? Are we able to post on agency websites? Yeah, so this PowerPoint slide will be emailed to everyone via PDF, as well as the YouTube video where this entire webinar is being recorded. So you guys are more than welcome to use that for reference as well.
And just to put one word of caution on that, which is great, of course, we would love these to be spread out, is that the information changes so frequently. So, if you got this presentation 2 weeks ago, it wouldn't have had the Johnson & Johnson vaccine in here. So just if you do have an event or something, we rather come and give you the latest presentation, and just really be mindful of the date on the presentation, that the information can change after that.
Yes, and that will also be included in the email, saying that this is as accurate as it is as of today, which is March 24th.
Great.
So we have another question, and it is, if a provider was distributing Pfizer, are they committed to do that vaccine forever, or can they get the Johnson & Johnson vaccine?
So providers can order more than one type of vaccine. All the ordering, or most, I should say, there are some federal programs, but most is through the health department. A lot of providers are opting to just do one vaccine because it's easier, in that they don't have to juggle different schedules, 1 dose versus 2 dose, different storage requirements. So you need special freezers for Pfizer. So all 3 vaccines, in fact, have different temperatures they have to be stored. So for that reason, I suspect that at least in the near future, a lot of providers will still be having just one vaccine type, but they will be able to get more than one type.
Awesome, thank you so much. And then a follow-up question from Marilyn Green. Can you email us the newer PowerPoint when they're updated? So the best way to get the newest PowerPoint is to, again, please contact the health department. They can provide you with the most up-to-date PowerPoints and numbers. They update that every day. And yeah, so I think that will be the best way to go about it. The PowerPoint that we're going to send from Emergency Management will be the one that is used today. Is there any other way to get the most up-to-date information, Rema?
So our webpage, and we have the main web site address right on the screen there, the nyc.gov/COVID vaccine. We have virtually everything I said today is on there in some way, shape, or form, probably in multiple places. There's a neat page that we worked on called Vaccine Facts, and that has a ton of the detailed information, more detailed than I went into today, in fact, about all the vaccines. So that's kind of our FAQ page, if you will. We also have a page dedicated just to eligibility, a page dedicated or a section of a page dedicated to all the documentation requirements when you go to get vaccinated. So if you're going and your eligibility is based on age, you have to show certain types of documents, or if it's based on your job, you have to show other types of documents. So we really have a lot of detailed information on our website, and I would encourage people to go there. And we also have handouts, and you can also call 311 if you have an event or somewhere and you need to order handouts. A lot of them we're still translating because we had to update them all with the Johnson & Johnson information. But many of our materials are in multiple languages. That's also a great place to go to if you need materials in other languages.
Great. And as we're running towards the end of our webinar, we only have some time for about maybe one more question. And this one is from an individual stating that if a person already has COVID-19, do they need to get the vaccine at a later date, or are they protected since they already have the antibodies?
So people that have had COVID-19 absolutely should get vaccinated. For one, we know it is possible to get COVID-19 again. And also the protection that the vaccine gives you could boost any protection that you already have in your system. So we don't want people to get vaccinated while they're sick with COVID, mainly because we don't want them to go out and potentially spread the virus. But once they are recovered from COVID, which for most people is 10 days from when their symptoms started or 10 days from their positive test, then we do encourage people to get vaccinated when they can.
Awesome. Rema, thank you so much for this. Again, you provided such great information for us, for the community, and we really do thank you for this. It has been absolutely amazing.
Okay, great.
Sorry, go ahead.
No, I was just going to say, if there's other questions, I do have some time, but I don't know if you all are running off somewhere.
Yeah, I think that we set this to end at 1:30, so
Okay.
some people might be hopping off. But if anyone does have any additional questions, please reach out to us at readyny@oem.nyc.gov, and we'll be able to pass along the questions to Rema, and we'll be able to get you the answers as soon as possible. Awesome. Well, thank you, everyone. Have a great afternoon, and please enjoy the weekend and the nice weather. And we'll talk to everyone soon next month. Have a great one.
Great. Thank you all.